A heartbreaking report in the New York Times peels back the curtain on a crisis plaguing African-American women in the country. According to the CDC, Black women are 3 to 4 times as likely to die from pregnancy-related causes compared to white women. Black infants are twice as likely to die as white infants. The report also reveals that even education and income don't really help. A study from the Brookings Institute found that a Black woman with an advanced degree is still more likely to lose her baby than a white woman with less than 8th grade education. The group Black Mamas Matter Alliance is raising awareness about this issue with Black Maternal Health Week that is happening right now as part of April's National Minority Health Month. Angela Doyensola Aina is the Programming and Research Chair for the group, and she joins me now. And I'm so glad you are joining me, Angela, to talk about this. It's alarming. A lot of people read the report in the New York Times. How did we get here?
Yes. Good afternoon, Michaela, and thank you for having me. We believe that we got here because of the historical trauma that has been placed upon Black women's bodies since the institution of slavery. And it's really the perpetuated systemic racism, discrimination in when we go to receive healthcare services, and gendered oppression. And that's really how we got here. A lot of the remnants of social determinants of health inequities is what really got us here to these alarming rates.
You know, I know that one of the things that helped bring this into the forefront recently was Serena Williams famously recounting her own near-death experience with pulmonary embolism when she, you know, gave birth to her little one, and how frightening she was and how grateful she was for the excellent health care she received, and realized that she was privileged, right? She has access to health care. How important is the work you're doing here to women in less than financially stable homes? And obviously, Serena Williams has means, but for the women who don't have means?
Right. It's very important for us as the Black Mamas Matter Alliance to do this work. And really, what's central to our work is centering the voices and the experiences of Black women. And that's why we're putting on the first ever National Black Maternal Health Week during this time from April 11th through the 17th. And what we're doing is centering the voices of Black women-led organizations that are doing maternity care work from a birth justice, reproductive justice, and human rights framework on the ground every day, and that don't always get the opportunity to amplify the work that they're doing on a national scale. So that's why the work that we're doing is very important, and that's why we need to continuously say that Black mamas matter.
Yes. Black mamas do. How do we continue to bring these numbers down? The work you're doing, you talked about you used the word amplify. You're right, this needs to be amplified across the state. I mean, the status is that the United States is one of only 13 countries where the rate of maternal mortality is worse than it was 25 years ago. What further can be done beyond the work that you're doing? What do you need from the rest of the country?
Well, first and foremost, we have to really be honest. A lot of Black women-led initiatives in maternity care is low resource, including ourselves. And it's important that, first and foremost, not only that we recognize that this is an issue and is being driven by systemic racism, but we also need to really trust Black women and invest in Black women maternity care work, such as our alliance and a lot of our kindred partners who are doing this work on a day-to-day basis, as I mentioned earlier.
Well, I'm so glad that we were able to profile this today and talk about it. It is shocking to see, to read, to hear the statistics and realize those statistics reflect lives that have been lost and lives that have hung in the balance. Angela Doyensola Aina, thank you so much for the work you're doing and for joining me to talk about it today.
Thank you. Thank you.